Good afternoon. Thank you, SLCOG and President, for allowing us to have this session to introduce what is a digital app for mother and child care. To start off with, just a brief take on Mega Life Sciences. It's an organization which is present across the world in 33 countries, and we are there across multiple portfolios, and the latest forays into digital health, where we aim to improve the lives of patients across the different disease categories. Moving on quickly, we would like to divide the entire talk into three sections. One is about the digital care itself. Why do we need digital in healthcare? What is the relevance of having digital in healthcare? Second part would be the application itself, the platform which is for mother and child, and what are the different features of the mother and child application. And third is how we aim to work with our doctors and healthcare providers across the spectrum. So why a digital support for maternity itself? What does digital do? Digital is but a tool to help augment what the doctor or the healthcare provider already does. It's never a replacement, but a tool to augment what the healthcare provider does. It is in one of the most inquisitive periods of women's health. Maternity is one of the a time of most inquisitiveness as far as the women's health goes. Second part is there is apprehension, but there is also excitement. So we should not look at it as a disease, but rather a condition wherein there is a lot of thought as to what is going on within her body. Third is there is a slow generational shift which is happening from the inclusive family support which used to be there to now, when there is a lot of self-reliance and women need to be empowered to take on what is happening with their body and their soon-to-be born child. The age group is increasingly getting digital native. Those of us who are digital immigrants, so to say, for us, digital is still a tool, while the digitally native does everything on the digital medium itself. So this too, healthcare too, shall happen on the digital medium. And to help quality information reach difficult to access places, geographically difficult accesses. What are the pain points for doctors? Why do they need, and what is the relevance when it comes to the digital? Let us look at it as the if only factor which all of us doctors encounter, which we say, hey, if only we had this tool to do a certain task. We encounter a lot of information asymmetry, which is what we are telling the patient, registering on the patient. After she's left our clinic, is she able to digest that and remember what we've told? Have we been able to tell her everything? And if not, what do we do to mitigate that issue? So there is an information asymmetry which the digital can probably solve. The access to communication, to be able to communicate with the patient and patient back to you at times when it's not really possible and they're not between consultations where it's possible to reach out to them. That is another use of the digital. Lack of availability of tracking and context. Many times, why is this happening to my body is a problem what the woman encounters. To give them the tracking and the context to be able to do that is another use. Lack of clear data. There is so much of data available all around which can be used in healthcare to help pass on and improve the health outcomes, but clear data is lacking. Here's another place where digital can really help. Geographical divides, as we said, where we can reach out across cities and across towns and have our digital footprint happen on areas which is far away from where specialist care happens. There are few trained specialists across the population in most of our countries, and it's really useful to be able to have a tool to be able to reach out and do that. And finally, for academic and research requirements, nothing that we do with our patients should be lost. If it's all captured, then we are able to augment our research and academic facilities. So having said that, should it be a multitasking tool like this, or should it be a tool for certain purposes? So here is where an important aspect comes. So digital is often to be used where it's required rather than to think about it as an all out there panacea kind of thing. There is also an opportunity to personalize. What is personalizing? Personalizing is essentially to be able to make sure that we can treat individual X the way individual X's condition needs to be treated rather than treating it like a vanilla case, right? So that is what personalized care eventually is. Why were we unable to do that? Because it is very difficult to capture everything about the patient during short periods of time and then be able to treat accordingly, to be able to prescribe accordingly, and so on. So here is an opportunity to be able to do that as well. So here is where having digital tools alongside would help us augment the way we treat and care for our patients. So it's not just about an either-or journey. Either we personalize or we don't personalize. It is not like that. It is going to be moving the needle ever so slowly to be able to treat the patient better and better as we get more and more information about her. So, of course, it goes beyond the clinical, and especially in pregnancy, which is not just a clinical condition. It is also about what else happens during that period emotionally. There is anxiety which is there to be alleviated. There is a sense of control which the woman loses, where we have a way of augmenting that. There is a visibility to plan for the outcomes of the pregnancy as far as the mother-to-be goes. And there is also a possibility of forming a community of similar peers who are all in the journey together. So finally, in that first part, just want to say that digital health in obstetrics can be used to bridge gaps. It can trigger appropriate reminders and alerts so that she never misses an appointment. Possibility to connect the doctor to the patient and create relevant triaging mechanisms so the more vulnerable can be taken care of, and of course, with research and academics as well. With that, I come and I introduce to you the WeCare Mother and Child Maternity Platform. Now, this platform is available across all formats, across all platforms, and it helps, one, to provide accurate and reliable information. Second is to be able to use trackers to be able to monitor maternal health and the health and well-being of a baby to be born, and it supports healthy behavior as well. It's got multiple tools within it. It's got trackers like weight trackers, belly circumference, kick counters, which is a unique tracker within the app itself. It's an in-app kick counter. There's a pregnancy journal. It's a time when the mother wants to share and add on. So that is another thing which happens. Journaling happens, and which she can do within the app itself. There are a lot of contents and checklists and reminders within the app as well. Every aspect of what the mother is doing on the application, she does it with relevance and context. Understanding why am I doing this, and then to be able to do it. A person so converted would then be able to feel the relevance and do it wherever it's required and wherever it's useful. Which brings me to the next part. I want to dwell a little bit about this aspect called localization. What is localization? The application can be in English, but you would have seen across the board translated material which is there on applications. Mere translation is not localization. For example, if we need to have it in Sinhala, we would not do a Sinhalese direct translation and just put it on the application. What we would want to do is to do it being contextually and culturally sensitive and make sure that we're respectful to the mother-to-be and the language that she loves and follows, and so we can be as relevant and identifiable for her. So that is what we would do with localization on the application. So working together, how do we work with our doctors? This is one of the key areas where we as an organization, we as a platform would love to work with our doctors and create that impact going forward. So WeCare and our doctors, what are the different things which we do? One is to create connected care modes or modules wherein the doctor can be connected with their patient in a real-time manner. Academic and research collaborations. While the data is being collected, respecting the security and privacy, we can still work with our doctors in de-identified or anonymized modes to be able to create that experience of leveraging the data and the value of the data to help them give better clinical care going forward. Reaching out to create an outreach, what does that mean? That essentially means that you are not bound by geography anymore. You can reach out to patients either by the doctor having her videos, her modules to her own patients or his own patients, out there in remote areas as well, where geography is no longer a barrier for communication then. Co-creating programs, of course, we can work together and create programs which can either be hosted on the application or via the platform on the media and so on. Eventually, all this sort of creates a community for better care. Most importantly and relevant clinically would be to connect your high-risk cases. A lot of obstetricians have those 10% of cases where they're a little worried about what is happening to my patients with a bad obstetric history or a PIH or a preeclampsia scenario or a GDM scenario. What do I do? Is she okay when she's not with me? She's there for 15 minutes. The next time I see her is like three months later. So to be able to connect with your patients, it's again a tool to be able to do that. So quickly I'll take you to what we've also on demand created along with the patient's application, which is a doctor's dashboard. For a cohort of your patients, you can also use the dashboard, which is available both on web and you can access it on your phones as well, for a set of your patients to keep track of what is happening to them being connected via the application itself. So either you can use it on your desktops or laptops, or you can use it like this. These are progressive apps. They can be used through the mobile as well. You can access them when you're on the fly and you're on the move as well. So these are some of the screenshots from the app itself or the dashboard which the doctor is able to access. So we will bring it to Sri Lanka based on the interest that you all have to be able to create that connected mode. Wherever it's required, we are taking them. And here as well, this is something which we intend to do. So eventually, what is the care ecosystem that we are talking about? It is an ecosystem of providers, which is the doctors, the nurses, the midwives, the support system, the application, everything together, and the mothers to be together. We form the care ecosystem, and that care ecosystem is it's a platform. It can be leveraged through the app or social networks. You can have community formations where they can even be peer-to-peer exchange of the most respected people are often the peers. They are well-informed peer who's able to, the older sister who's able to sort of get through to the patient, having content and campaigns which we can run and then sort of take this entire process forward, empowering larger groups of population than what each individual provider can do. Last two slides would be about the platform itself. This is a maternity platform. We also have a platform for diabetes and for telehealth and wellness. We have integrations of different kinds which are possible within it. Hardware as well is being integrated in different spaces. One note which is of concern to pretty much everybody, patients, doctors and everyone else. What's the security like? What's the safety like? Many of our countries don't have a strong security mandate or a privacy mandate. But what we as an organization which is running across different countries follow is the European GDPR, which is currently the most stringent of privacy laws which exists. And we are using all the tools which are scalable across all the markets in the world. This is a QR code. We will have it in the stall as well, and wherever you need to, you can download the app and check it out for yourself and give us feedback or start recommending it to the patients and so on. Directly through the QR code, you'll end up on the App Store and you're able to access the application itself. So with that, I thank you for a patient listening. Thank you very much.